This is Plant-Based Briefing, Alcohol, 16 Reasons to Rethink Your Drink by Thomas Campbell, MD, at nutritionstudies.org. And I'm Marian Erickson, host of this plant-based podcast where I curate, get permission, and narrate a variety of articles on healthy, compassionate, and sustainable living in about 10 minutes or less every weekday. And as always, I put a link to the original post in the show notes. If you're interested in checking out all of the studies and sources cited, you can find those by clicking that link and going to the original post. So now let's get to today's plant-based briefing. Alcohol, 16 Reasons to Rethink Your Drink by Thomas Campbell, MD, at nutritionstudies.org. A recent study suggested a trend toward reduced fertility with high alcohol consumption, defined as more than 14 drinks per week, but the results were not statistically significant. Other studies supported this finding, while others disagree. Of course, alcohol consumption during pregnancy is a bad idea, being a cause of miscarriage, fetal alcohol syndrome, alcohol-related neurodevelopment disorder, ARND, and alcohol-related birth defects. So drinking and pregnancy do not mix. I'm sure that's not the most astonishing news you've heard today. Beyond fertility issues, alcohol intake has been linked to worse outcomes in numerous conditions, as follows. Number 1, cancer. Excess alcohol consumption may increase the risk of the following cancers. Colorectal cancer, 10 to 20% increased risk with usual consumption of 50 grams daily or 3 to 4 standard-sized drinks daily. Breast cancer, for each 2/3 of a drink consumed daily, 10 grams alcohol, risk increases by 7 to 10%. Cancer of the oral cavity, pharynx, larynx, less than 2 drinks daily equals 86% increased risk, 3 to 4 drinks daily equals 311% increased risk. Esophageal cancer, less than 2 drinks equals 39% increased risk, 3 to 4 drinks daily equals 93% increased risk. Stomach cancer, pancreatic cancer, and lung cancer have less certain relationships, but may be related to alcohol. Number 2, stress urinary incontinence, where a sneeze or cough causes leakage of urine, 2 to 4 times more common among women who consume alcohol. Number 3, depression. Alcohol consumption is associated with depression and has biomechanical effects that explain how it causes and exacerbates depression. Number 4, hemorrhagic stroke, a type of stroke where a blood vessel breaks open. More than 4 drinks a day are associated with over 200% increased risk. Number 5, pneumonia. 2 drinks a day increases risk by 13%. More drinks led to higher risk. Number 6, high blood pressure. Just 2 drinks a day is linked to a 25% increased risk in men. More is linked to higher risks. Number 7, heart rhythm problems. More than 2 drinks daily are linked to about a 15% increased risk of conduction problems. Number 8, pancreatitis. High alcohol consumption strikingly increases the risk of pancreatitis. Number 9, liver cirrhosis. High alcohol consumption increases the risk of liver cirrhosis and failure. Number 10, addiction. 7% of American adults have an alcohol use disorder, which includes alcohol abuse and alcohol dependence. Number 11, insomnia. 35 to 70% of people who chronically drink alcohol have insomnia, a much higher rate than the general population. Number 12, heartburn. Alcohol can hamper the function of the sphincter barrier between the esophagus and the stomach, leading to acid reflux and heartburn. Number 13, leaky gut. Alcohol can disrupt the barrier function of the intestine, allowing large molecules that normally couldn't be absorbed into your body. 14, disrupted nutrition. High levels of alcohol consumption inhibit the absorption of various nutrients. 15, psoriasis. Alcohol may be a trigger for psoriasis exacerbations. And number 16, obesity. Alcohol contains lots of calories, and people may not compensate for those calories by eating less food. Alcohol may even stimulate appetite. That said, observational data does not link alcohol intake with weight gain. Many of these problems are common issues that people struggle with daily, ranging from annoyances to life-threatening diagnoses. In addition to these issues, excessive alcohol use helps to cause a whole collection of serious injuries, including drunk driving accidents, falls, violent injuries, or drowning. 31% of traffic fatalities involve alcohol. In all, it is estimated that more than 140,000 people die from alcohol-related causes annually in the U.S. What about the benefits of alcohol we've all heard about? There's evidence that light or moderate drinking is significantly associated with a reduced risk of heart disease, ischemic stroke, the kind caused by a clot in the blood vessel, and diabetes. However, these associations should be balanced against the negative effects listed above. And while I've listed a large, impressive list of health problems, Many of these dangers are related to excessive alcohol use, but some are not. For example, there's no clear threshold below which alcohol consumption seems to be okay for certain cancers, and even one drink can affect heartburn or sleep. All doctors have seen plenty of tragedy caused by alcohol and treat many chronic issues like heartburn, obesity, and high blood pressure that may be related to alcohol. People commonly ask me about beverage choices, particularly alcohol. After reviewing some of the evidence, I suggest, if they don't have a health problem listed here, that an occasional social outing with a drink or two is fine. But folks who find themselves drinking almost every day may be at high risk for promoting one of the problems above. High-risk drinking is considered to be more than 1 drink daily for women, or 7 drinks weekly, and more than 2 drinks daily for men, or 14 drinks weekly. If, for whatever reason, someone is getting anywhere close to those levels of consumption, I strongly suggest they rethink their alcohol consumption. You just listened to Alcohol: 16 Reasons to Rethink Your Drink by Thomas Campbell, MD at nutritionstudies.org. And I'm your host, Marian Erickson. I've done a number of other episodes on alcohol, mostly around vegan wine and vegan beer. But I have done one on the health risks of alcohol. Check out episode 265, Do Any Benefits of Alcohol Outweigh the Risks? By Dr. Michael Greger at nutritionfacts.org. And an interesting thing he points out in that episode is that studies that show the benefits of alcohol are extremely misleading because they have a systematic error of misclassifying former drinkers as lifelong abstainers. And the problem was that many of the people they classified as non-drinkers were actually heavy drinkers who had quit in response to ill health. So having these relatively unhealthy people classified as lifelong abstainers made those who drink moderately look healthier than the abstainers. He explains this all in that episode, so check that out if you're interested. And please share this episode with anyone who might benefit, and thanks for listening.